Welcome to the Deep Dive. We're here to help you cut through the noise and get straight to what you really need to know. Today, we're tackling a huge topic, absolutely foundational for anyone heading into nursing: antenatal assessment, care, and education. So if you're a nursing student, think of this as your essential guide, your shortcut to the critical knowledge you'll need in practice, our mission. To really unpack the vital info from our sources, we're zeroing in on the pathophysiology, recognizing those key signs and symptoms, getting a handle on nursing care and interventions, and crucially, understanding treatments, including specific medications. We want to get you up to speed quickly, but, thoroughly. This stuff really impacts lives.
It absolutely does. And that's why this kind of deep dive is so important. Antenatal care isn't just a checklist of appointments. It's truly the foundation for a healthy start for both mother and baby. It's all about spotting potential issues early, empowering people through education, giving support, understanding this isn't just about knowing what to do. It's about understanding why it matters in, well, every single patient interaction. It's about providing truly holistic care, not just following steps.
Okay, so let's unpack that. What's the main objective of antenatal care, and why is getting in early so critical, sometimes even before pregnancy?
Well, the core objective, like you said, is optimizing health outcomes for both. It's a continuous process, really. Identifying risks early, providing solid health education, counseling support, all through the pregnancy journey. It's fundamentally preventive care, trying to ensure the best possible start. And that focus on early really includes what we call preconception and interconception care. Care before someone even conceives and care between pregnancies.
Right, getting things optimized beforehand?
Exactly. It lets us identify and tackle potential risks before new pregnancy. We're talking genetic factors, existing conditions like, say, diabetes or high blood pressure, family history, things that could really affect a pregnancy. Addressing those up front, it just sets a much healthier stage, makes a huge difference to outcomes.
That makes complete sense. Setting that healthy stage. I noticed some data point. It mentioned that while over 77% of women started prenatal care in the first trimester back in 2015, it only nudged up slightly to 77.6% by 2020. What does that slight stagnation or maybe slower uptake mean for you as a nurse when you encounter patients starting care later?
It means we have to be incredibly adaptable and diligent. If someone starts care later, say in the second or third trimester, we need to be extra thorough. Get that comprehensive history, do a really complete physical exam, make sure all the necessary screening gets done. Even if it's delayed, you have to think about missed opportunities for identifying risks earlier.
So you're playing catch up, essentially.
In a way, yes. It just underlines how vital every single visit is, no matter when it starts. Our vigilance often becomes that crucial safety net for the patient.
Okay, so groundwork laid. Let's get into the nitty-gritty of that first actual encounter, the initial prenatal visit. What are the absolute must-knows for a nursing student during that assessment?
Right. That first visit is huge. It's a deep dive into their whole health picture. You start with a detailed obstetric history, very specific stuff. Things like gravida, that's the total number of pregnancies ever, and para, the number of deliveries after 20 weeks gestation. You also need to know about any past abortions, spontaneous or induced, how many living children they have, the length of previous pregnancies, baby weights, types of deliveries, vaginal, C-section where they delivered, any issues with the anesthesia before. Each piece helps build that picture, flags potential risks.
Got it. So that's the pregnancy history. What else?
Then you dive into the medical and surgical history. You need to review everything: current conditions, past conditions, diabetes, hypertension, asthma, thyroid issues, you name it. And crucially, infections. STDs, rubella history, varicella, Hep B, HIV status. Ask about surgeries, hospital stays, blood transfusions. And medication use is vital: prescriptions, over-the-counter stuff, supplements, alcohol, any illicit drug use.
Why is getting all that detail so critical from a nursing perspective?
Because pre-existing conditions or past exposures can profoundly impact the current pregnancy. They affect the underlying pathophysiology, you see, and they often dictate specific management plans or interventions you'll need to implement or educate about. And then there's the psychosocial history. This is sensitive, but absolutely essential. Substance use, screening for domestic violence, mental health history, also looking at things like financial resources, social support systems. Your role here isn't just to ask the questions, but to create a safe space, listen, and connect people with resources if they need them. It's a huge part of that holistic care we talked about.
So we've gathered the whole story, all that history. How does that translate into the physical exam? What are we actually looking for? What signs tell us about the pregnancy itself?
The physical exam builds right on that history. You start with vital signs. Accurate BP is key. Hypertension could be an early warning for preeclampsia, which we're always watching for. Pulse is usually 60 to 90 beats per minute, respiration 16 to 24. Temperature normally around 97.8 to 99.6 Fahrenheit.
And what if they're off?
Well, abnormalities are clues. Persistent tachycardia, a fast heart rate, might signal infection, maybe hyperthyroidism, high blood pressure, like I said, preeclampsia risk. Low BP could be various things. The real skill for you as a nurse isn't just taking the vitals, but interpreting them. Even subtle changes, like a BP that's consistently low normal or a slightly elevated pulse over time, can be the earliest hint of a problem. Sometimes before the patient feels anything is wrong. It's your early warning system.
Okay, so vitals first. What's next?
You'll get weight and height to calculate BMI. That helps identify risks, gestational diabetes risk, maybe risk for a small baby. Then the abdominal assessment. You measure fundal height, that's the distance from the pubic bone up to the top of the uterus, the fundus. It gives you a good estimate of gestational age and lets you track growth over time.
And those Leopold maneuvers.
Right, Leopold maneuvers, that's where you use your hands to systematically feel the abdomen. You're trying to figure out the baby's position, where's the head, the back, the limbs. It helps you understand fetal presentation, which is important for delivery planning.
Makes sense. And then a full system check.
Exactly. A comprehensive system-by-system check. You look at musculoskeletal posture changes, joint looseness due to hormones like relaxin. In tegumentary, you might see melasma, the mask of pregnancy, linea nigra, stretch marks, maybe spider veins. Endocrine, check the thyroid, look for signs of diabetes. Gastrointestinal, check dental health. Gum inflammation is common. Ask about bowel function, heartburn, nausea. Urinary, look for UTI signs. They can be silent, but risky. And finally, the reproductive system exam, external and internal. You're looking for classic pregnancy signs like Chadwick's sign, that bluish color of the cervix and vagina. Due to increased blood flow, right? Precisely. And Higar's sign, the softening of the lower part of the uterus. Goodell's sign, the softening of the cervix itself. You'll also do a Pap test for cervical screening and screen for STDs. Each bit adds to the overall picture, guiding your care.
Wow, okay. That initial visit covers so much ground. It really is foundational. So after the history and the physical, what about the lab work? How does that tie everything together and really guide nursing care?
The labs. Yes, they provide that crucial objective data. Think of them in a few categories for that initial screen. First, general maternal health, blood count, blood type, immunity status. A complete blood count, CBC, is standard. It checks for infection. A high white blood cell count, say over 15,000 without another clear reason, could be an infection. It also screens for anemia, low hemoglobin, or hematocrit. Anemia is common, often iron deficiency, so you might need to educate about iron supplements.
Okay. CBC for infection and anemia. What else?
Then, specific infection screening relevant to pregnancy. We check blood grouping, Rh factor, and do an antibody screen. This is critical for Rh incompatibility. If the mother is Rh negative and the father is Rh positive, the baby could be Rh positive. The mother's body might then make antibodies against the baby's blood. So if she's Rh negative, she'll likely need Rho-D, immune globulin, you probably know it as Rojam, to prevent that antibody formation.
Right, Rojam, essential stuff.
Absolutely. We also screen for syphilis using a VDRL or RPR test. A rubella titer checks immunity to German measles. If she's not immune, exposure during pregnancy is dangerous for the fetus, causing potential anomalies. So non-immune mothers would need the vaccine postpartum, not during pregnancy. We also do a TB test if needed, screen for hepatitis B and HIV. Knowing these statuses is vital for managing risks to the baby and providing the right counseling.
Got it. General health, key infections. What else?
Then tests looking at ongoing pregnancy stuff and other risks. A urinalysis is a routine. We check for protein, could be a sign of preeclampsia. Glucose, potential gestational diabetes. Nitrites or leukocyte esterase signs of a UTI. A Pap test screens for cervical cancer. We might do maternal serum markers like AFP, HCG. Estriol, these screen for certain fetal anomalies like neural tube defects or chromosomal issues. And later, usually around 24, 28 weeks, a glucose challenge test screens for gestational diabetes.
So how do these results directly guide you as a nurse?
Directly. Anemia. You educate on iron intake, supplements, maybe side effects like constipation, positive STI. Education on treatment, partner notification, safe practices, non-immune to rubella. Counsel on avoiding exposure, abnormal glucose screen, more testing, dietary counseling, maybe insulin education down the line. Your nursing judgment connects these lab results to specific actions and patient teaching.
That's a huge amount of info from those labs, but seeing how it connects makes sense. Okay, let's shift gears a bit. From diagnosis and screening to the day-to-day experience. What about those common discomforts of pregnancy, the everyday challenges people face, and how can we, as future nurses, help them manage, including, specific treatments or medications?
Right. Pregnancy definitely comes with its share of discomforts. And yes, nursing support and education are key. Let's take nausea and vomiting morning sickness, though it can happen anytime, often linked to hormonal shifts, like rising HCG and estrogen. Simple advice helps. Dry crackers before getting out of bed, small frequent meals, avoiding greasy or spicy triggers, staying hydrated. Acupressure bands can sometimes help too.
And if that's not enough,
For more persistent nausea, vitamin B6 pyridoxine is often recommended, sometimes combined with doxylamine. These are generally considered safe and effective. But it's important you distinguish this common nausea from hyperemesis gravidarum.
yeah.
That's severe, persistent vomiting causing weight loss and dehydration. It's a different beast. Needs much more intensive medical management.
Good distinction. What about heartburn? Super common, right?
Very common. Often caused by progesterone relaxing that sphincter between the esophagus and stomach, letting acid reflux up. Again, dietary advice. Small meals, avoid fat, spicy foods, carbonated drinks. Don't lie down right after eating. Over-the-counter antacids can help neutralize the acid. Things like aluminum hydroxide, magnesium hydroxide, or calcium carbonate are typical choices.
Okay. And backache, that seems almost universal.
It really is. Changes in posture, the weight of the uterus, plus ligaments getting looser from relaxin. It all contributes. Good posture is key. Specific exercises help pelvic tilts, tailor sitting. Supportive shoes make a difference. Heat or cold packs can offer relief too. Then there's round ligament pain, that sharp pain in the groin area as the uterine ligaments stretch. Changing positions slowly, gentle stretching, applying warmth often helps manage that.
What about things like varicose veins or hemorrhoids?
Yeah, varicosities in the legs happen due to increased pressure in the veins and hormonal effects. Advice includes avoiding long periods of standing or sitting, elevating legs when possible, wearing support hose to help circulation. Hemorrhoids are similar varicose veins in the rectum, often worsened by constipation and pelvic pressure. High fiber diet, lots of fluids are crucial. Warm sitz baths can soothe. And topical treatments like anesthetics containing lidocaine or witch hazel compresses can reduce pain and swelling.
And the constipation itself.
Big issue. Hormones slow digestion. The uterus puts pressure on the bowel. Iron supplements can contribute. Recommend fluids at least 8 glasses a day. Lots of fiber from fruits, veggies, whole grains. Leg cramps, especially at night, can be troublesome. Stretching the muscle helps immediately. Applying heat can relax it. Sometimes it's linked to mineral balance, calcium, phosphorus, magnesium, so ensuring adequate intake might be discussed with the provider. And lastly, dependent edema, swelling in the feet and ankles. Elevating legs helps, as do support stockings. It's usually normal, but needs monitoring to distinguish from preeclampsia-related swelling.
That's incredibly practical, stuff nurses can really help with day to day. But beyond those manageable discomforts, what about the serious stuff? What are those critical warning signs that every nursing student absolutely must know cold, the real red flags that need immediate action?
Yes, these are the signs that scream danger and need immediate medical assessment. Any vaginal bleeding or a sudden gush of fluid from the vagina. Bleeding could mean miscarriage, placenta previa, placental abruption, all serious. Fluid likely means ruptured membranes, raising infection risk.
Okay. Bleeding or fluid loss, what else?
Significant swelling, especially of the fingers, face, or around the eyes. This isn't just the mild ankle swelling. This is more concerning for preeclampsia. Also, a continuous pounding headache that doesn't go away. Or visual disturbances, blurred vision, seeing spots, flashing lights, and certainly any seizures. These are all potential signs of severe preeclampsia, chronic hypertension, or even eclampsia, which is life-threatening.
Extremely serious signs.
Definitely. Chills or fever could signal an infection, which needs prompt treatment to protect both mother and baby. Painful urination strongly suggests a UTI. Untreated UTIs can lead to kidney infections or preterm labor. Persistent vomiting, like we mentioned with hyperemesis gravidarum, especially if it leads to dehydration or weight loss, needs intervention.
And related to the baby.
A noticeable change in fetal movement, either decreased movement or a significant sudden change in the pattern or strength. This is a critical sign of potential fetal distress or compromise and needs immediate evaluation. And finally, any signs or symptoms of preterm labor. This could be uterine contractions, persistent cramps, a constant low, dull backache, pelvic pressure, or a change in vaginal discharge, maybe watery or blood-tinged. Catching preterm labor early is vital for interventions that might delay birth. These aren't things to wait on. They require immediate medical attention and swift nursing assessment.
That's a powerful list. Knowing those signs inside out is clearly crucial. Okay, final stretch here. Let's talk about preparing for the actual birth. What's the role of education and how do nurses support pain management during labor?
Childbirth education is hugely important. It empowers parents. The goal is to help them understand the whole birth process, develop a birth plan if they wish, learn about the physical and emotional changes they'll go through, and importantly, learn different ways to cope with pain. It really helps reduce fear and gives them a sense of control over the experience.
And what kind of pain management techniques are taught? How do nurses facilitate those?
Nurses are central to teaching and supporting these, especially non-pharmacological methods, both in classes and right there during labor. Positioning is a big one. Encouraging movement walking, sitting upright, squatting, kneeling, uses gravity, can ease pain, and actually help labor progress. Hydrotherapy using a warm shower or bath can be incredibly soothing. The warmth and buoyancy relax muscles, reduce tension, and just feel good during contractions.
Relaxation sounds key too.
Absolutely. We teach various relaxation techniques: progressive relaxation, tensing, and releasing muscle groups; neuromuscular dissociation, learning to relax the muscles not involved in the contractions; touch relaxation, responding to a partner's touch by releasing tension; cutaneous stimulation uses touch to block pain signals. Think effleurage that light, rhythmic stroking on the abdomen or back, or using heat or cold packs, thermal stimulation.
What about focusing the mind?
Right, mental stimulation. Massage helps reduce muscle tension. Imagery, focusing on positive, calming mental pictures. Using sounds, like music or even just vocalizing, can be a great distraction and relaxation aid. Focused breathing techniques, slow-paced, patterned breathing help with oxygenation and provide a rhythm to focus on, reducing the perception of pain. And never underestimate the power of support. Having a continuous supportive presence, whether it's a partner, the nurse, or a doula, provides immense comfort, encouragement, and advocacy. As nurses, we're actively coaching, suggesting techniques, creating that supportive environment, helping them find what works for them.
What an incredibly comprehensive deep dive today. We've really covered the map of antenatal care, haven't we? From why preconception care matters, through that detailed initial assessment, the history, the physical, decoding those vital labs. We've touched on managing those common pregnancy discomforts with practical tips and specific treatments, and crucially, highlighted those critical red flags that demand immediate action. For anyone stepping into nursing, this knowledge isn't just helpful, it's absolutely essential. It really is the blueprint for providing safe, effective care.
It truly is. And this deep dive really underscores that while all the medical knowledge, the pathophysiology, the interventions are vital, true holistic antenatal nursing goes deeper. It's about profound psychological and social support too. So here's something for you, our listeners, to think about. Beyond the physical assessments and interventions, what specific aspect of supporting a birthing person's emotional and cultural needs do you anticipate being the most challenging, yet maybe the most rewarding, part of your nursing practice to master? Consider those complex human interconnections you'll navigate every day.
That's a fantastic question to ponder as you continue your journey. A huge thank you for joining us on the deep dive today. Take this knowledge, use it, keep asking questions, and keep learning. We'll catch you next time.